Hey, it's Denise. Welcome back, and if it's your first time watching one of my videos, welcome to my channel. I wanted today to talk a little bit about, well, actually maybe a little bit more than a little bit, I should just be honest. It might take a few minutes. I wanted to talk about medication again. I did a video about the costs of medication and it was about why healthcare is important. I think, is basically the name of the video, but one of the things I talked about was medication, but I was talking in that one predominantly about the cost of it and, that being why healthcare is important. Today I wanted to talk the more practical side of medication. As a disabled person who lives with, my disability is from a spinal cord injury. But in addition, I have chronic migraines and I have asthma, which is bad enough that I have been hospitalized repeatedly over the course of my life. I didn't get hospitalized for the first time until I was 40, actually. I'm 52, if you're someone who's new to the channel. But yeah, so my asthma can get, when it does flare up, it can get bad enough that I'm in the hospital for a prolonged period of time, not even just like overnight. The longest hospitalization I had was 18 days. Well, 18 nights, 19 days by the time they get you out of there. So I wanted to talk a little bit about the medical management, just so people have an idea of how involved it can sometimes be managing chronic illnesses. And asthma and chronic migraines both definitely fall under the category of chronic illness. I'm going to have these things for the rest of my life, and they're both severe enough that I have to be on both preventative medications and also have medication on hand for when the symptoms break through, even though I'm taking the preventative medication. In addition to that, I have allergies and I have sinus issues sometimes. So I've been kind of struggling with the sinus issues. If you watch my videos, you may have heard me mention it over the last 2 months. I've been kind of having a come and go, like my sinuses just don't want to stay clear. So this pile you see over here is kind of just to give you an idea of my medications. The reason I decided to do this again, this particular video today, is because today is the 23rd of the month. And on the 23rd of every month, I take an injection that I have to give myself. It's called Aimovig. I can take it out of the package. I think I showed it to you in one other video. Just like trying not to have like my personal prescription number and stuff. It's the only reason I look like I'm being cagey holding stuff out of camera over here. Forgive me. It's got those little tape circles, and I'm trying to be like, I can take this apart with my hands. I don't need the scissors. Who needs the scissors? Okay. You can see there, it pretty much spells it out for you. It's one injection once a month. This is one of the preventative medications I take. I take this injection once a month, and I take a tablet twice a day. So I have a daily, actually twice daily pill, and a once monthly. I don't know why the color on my monitor, it can't decide if it wants me to be like pink or this weird bluish color. We'll pretend that I'm not changing color because I don't really know why I am. Okay. I'll do this last, the injection, just in case. I know some people, for whatever reason, may have issues with seeing somebody get an injection, although if you've been watching the news lately, you've seen a lot of people getting immunizations. But I realize that bothers some people, seeing people get an injection. So I can do that last, or actually, I could do it probably right here, because if you know anyone who takes insulin, any of the same spots that you would give insulin is where you would use this. You would use this the same way you would use an EpiPen. So you're looking for that, where you got some subcutaneous, where you can grab a little squishiness. an immunization, they're using a much longer needle and they're going into muscle. When you're giving yourself an injection like from an auto-injector like this, which is similar to an EpiPen, you're not aiming for muscle, you're aiming for subcutaneous tissue, and that's why you give it into kind of fleshier areas of your body. So, yeah, I can actually do this. It's been out of the refrigerator. This lives in the refrigerator, and its retail price is over $700 per dose. So I've had it out for the amount of time it needs to cool off. So I am going to do this now. If you at no point will see any needle or blood, but if just knowing, just seeing me put the auto injector against my skin is going to bother you, just look away for a couple seconds when I say I'm about to do it, and then I'll say I'm done. First, you just take, people have asked me how you use an auto injector. You take the safety cap off the end. I'm telling you, this is such a non-event, but I am about to give myself the injection. Again, no needle shows, there's no blood. But if you think seeing it will bother you, either skip ahead a few seconds or just, like, literally, it will be a few seconds. So I'm going to do that now. You just pick an area, usually like anywhere there's a little bit of flab is fine. You hold it against your skin. It hasn't done anything yet. When I push this, that click was the needle. That second click was the needle letting go and retracting. Okay, I'm done, for those of you who are looking away. You can look at it now, and you see where that yellow bar is going across? That had been a clear chamber. That's where the medication actually was. So the fact that it's yellow is telling you that this is empty. It's been used, it's empty, and you can see there's no needle sticking out. It retracts back in after it's used, and that makes it safe to dispose of. Nobody can accidentally get stuck on it. Just to be extra safe, I always still put the safety cap back on before I dispose of it. But yeah, so once a month I do that. If you watched, you saw that it was no biggie. It doesn't really hurt. I mean, is there a little pinch? Yes. Is it a big deal? Not at all. So if your doctor does suggest one of the injectable meds for you and you're thinking, oh, I don't know if I could give myself an injection, I have to say personally, I don't find it difficult. And the medication itself doesn't burn or sting once it's injected the way that some medicines do. So, like right now, I mean, can I vaguely feel where I gave the shot? Yeah, I'm like vaguely aware that I just got a shot there, but like, is it hurting or burning? No, it's not. So, yeah, once a month, I have to do that. Like I told you, twice a day, I take a tablet that's a preventative medication for migraines. I take that in the morning, and I take it before bed. I mean, not like right to the minute before bed. Like, I try to leave it a little closer to every 12 hours than that, but, so a couple hours before bed. And so then what happens if I still get a migraine in spite of the fact that I'm on those two things? Well, if it's relatively mild, I can start out with some Excedrin, like anyone else might. Most of the time for me, that's not going to work, because if it was going to be that mild of a headache, it probably wouldn't have broken through the two preventative meds that I'm taking. So I do have a prescription tablet that is usually effective enough at controlling the symptoms. Now, that is Furacet. If you have migraines, you may or may not have tried it at some point. It might be part of your plan for dealing with them. It's a pretty common medication for not preventing, but for treating a migraine that has already started. And if you're someone who only gets migraines very infrequently, then you probably are not on a preventative. You probably just take something to treat your migraines when you get one. Chronic migraine is defined as 15 or more migraine days per month. So pretty much at least half of your days having a migraine. And that's my case, obviously, or I wouldn't be on medication for chronic migraine. Okay, so if I've tried the Excedrin and it didn't do anything, or if I can just feel like, because sometimes when they come on, it's not subtle. It's just all of a sudden, whoa, I'm getting a migraine. Like, it just, the aura, which for me is the right side of my head where 99% of my migraines are, the right side of my head will start feeling warm. My hands get really cold. My vision gets a little funny. Like, say if I'm looking at a page of text, it looks like the white of the paper is almost like a light source. It's almost like glowing, and the black letters are kind of floating on it. Like, my eyes definitely start seeing things differently. And I know that's, the pain is coming shortly once those things start. So at that point, I'm not going to bother with Excedrin if I start getting a real strong aura like that. I'm going to go straight to the prescription medication I just showed you. Or recently we added to the plan because, like, last month I went through, this was the month before it started, I went through like 3 weeks of a migraine before I got to talk to my neurologist, have a telemedicine appointment with my neurologist. And he added I was about to say oral medication. Speak English, Denise. An additional, rescue medication, or in the case of migraines, it's called an abortive medication, meaning you're trying to abort a migraine that has already started. You're not trying to prevent, prevention has failed at this point where you're trying to end something that has started. So this is called Nurtec. I don't know if I grabbed the open one or the new one. You may have heard me rant a little bit if you watched my video about why I think healthcare is important. There are 8 pills in here, and this retails for over $1,000. $1,000 for 8 pills. And that's the amount that you're allowed for a month. So my insurance had to get pre-authorization, which means my doctor's office had to do extra paperwork to get the insurance to agree to cover it, even though, like anybody, I pay for my insurance every month. Even though I'm disabled, if you want to have prescription coverage, you pay for it. But yeah, they sure try to take every opportunity to not pay for your stuff. So yeah, your doctor sometimes has to kind of fight for you to get them to approve to pay for something. And this, it pops out here. You can see, like, you slide it out. Oops. And there's the 8 pills. You can see, like, they're individually packaged. You peel the pack. This is the new one, obviously. I think I have one left in the old one. You peel it, and then it's almost like it weighs nothing. It's the shape of this little thing that they poured. It's like they poured it into there. Have you ever gotten those meringue cookies? They're just like a little puff. They feel like there's no weight to them. That's sort of what this is like. It's like a little tiny white meringue. And I'm trying to think. It tastes a little bit like mint or something. I don't remember exactly. I think it's mint. I could be wrong. Not the greatest tasting thing. Not the worst. But you let it melt in your mouth. And you can only take this, you can take one a day. And like I said, you get, with my insurance paying for it, luckily it only cost me, I believe, $45. I ended up actually paying for it. Excuse me, my throat is dry and I'm starting to sound a little gravelly. Hopefully that's better. Okay. But you only get 8 for the month, which means if you're having breakthrough headache on more than 8 days a month, you have to decide, is it bad enough that I only use one of my doses of this, or am I just going to try to get by with the other stuff? So that's something that you have to keep in mind. And it's unfortunate that we have to make that decision, but that's life, right? So then onto the asthma end of things. I just wanted to make a distinction. And again, we have preventative. Brio is a pretty common preventative inhaler. There are a lot of inhalers like it that are preventatives, that they contain an inhaled corticosteroid, so like something like in the cortisone family, not to be confused with anabolic steroids, the ones that are illegally used in sports, not to be confused with hormone replacement therapy type medication. No. Think of this as like cortisone cream, but for your lungs. It's in a microfine powder form. This particular inhaler does not use a propellant. Like I was starting to say though, this is a 2 medication inhaler. It has that steroid, which helps to keep down any inflammation in my lungs, and it has a long-acting bronchodilator, which helps keep my airways open. This is something I use every day. These are also expensive, and I have gone through periods, including quite recently, where I was only using it every other day because I couldn't afford, even with the copay, these can be over $50 each, and I was having to make it last 2 months, so I was only taking it every other day, which is not ideal. I take also a pill at night, Singulair, which a lot of people with allergies or asthma take, which also helps to prevent reactivity in your airway. Now, I just wanted to kind of show the difference. Like, this is a rescue inhaler. A lot of people are familiar with them. It's what you would use if you actually started to wheeze or feel short of breath. This is a fast-acting and short-acting bronchodilator. It helps just quickly open up your airways if you are having symptoms. And this is probably what most people think of. And yes, I'm going to waste a dose here, but this is the kind that has a propellant. If you listen, you saw that. I squeezed it. You heard a puffing sound. It uses a propellant, just like, think of like cooking spray or something else that uses a propellant, and it shoots the medication out as you're inhaling it. This one does not use a propellant. Each dose, it's almost kind of like a little wheel with the little tiny bits of microfine powder. You might be thinking inhaling powder, you would start choking. You don't. Trust me, used these type of things for years. But this one I will show you. And again, like, I can't tip it over once I click it open, because the act of clicking it open actually punctures the little tiny container that is the single dose, and you'll hear the click. Now it's just a matter of breathing it in. And closing it. Now, whenever you use any kind of steroid-based inhaler like that, you want to immediately rinse your mouth right afterwards. Because if you don't, and I can tell you, they're not just threatening you with this. It really happens, because I get it, even though I do rinse my mouth. You get what's called oral thrush, which is basically a fungal infection in your mouth. And yeah, it's as unpleasant as it sounds. So I've got, this is my preventative, and the tablet I take at night is a preventative. This as a rescue if I start wheezing in spite of the fact that I'm on 2 preventatives. I have a nebulizer, which is the machine that you put the liquid medication in, that it then turns it into like a cool mist that you're breathing it in. That would be if the rescue inhaler didn't help and I was still feeling short of breath and tight. At that point, if I have to start using that, I need to call my doctor, because then I would have to start taking oral steroids, which I hate. They have so many side effects. I won't go into it. But for me, the worst is the mood swings and the inability to sleep that they cause. So yeah, I'm like miserable, nasty, impatient, and then like alternately just want to cry over everything. And I can't sleep. And the more days I'm on it, just like the worse it gets. And like I said, they do a bunch of other things to you too, none of which are good, except the fact that they're helping get the asthma back under control. The allergy and sinus end of things, I've been on 1 prescription nasal spray that I take twice a day for a couple of years now. And just recently, my doctor added a second one to help deal with the chronic congestion, because the over-the-counter nasal decongestant sprays like Afrin and those type of things are really not good for you on any sort of long-term basis. I mean, for 2 or 3 days when you have a cold, that's kind of how it's meant to be used. If you keep using it much longer than that, you're going to get what they call rebound congestion, which basically means even if whatever was initially causing the congestion is completely gone, your nose has become almost like addicted, if you want, not in the true sense of addiction, but in the sense that when the Afrin wears off, the congestion comes back simply because you've been using the Afrin for so long. So that's why you don't want to make a habit of using it. If you have to chronically take something for congestion, you should probably talk to your doctor and get on something that's easier on your nose and all of you for that matter. Because like Sudafed, which has been around forever, great for decongesting your nose, but it can make, like for me, it makes my heart pound. Like my pulse almost doubles and like my heart feels like it's pounding out of my chest. And so I would rather not take that if I don't have to. So yeah, currently on 2 prescription nasal sprays. I've shown you before. This is the case I use to organize my pills for the week. This, I use vitamin patch, multivitamin patch. I've shown you this before. If you haven't seen the video where I showed you this, it's just you can see the patch. It's hard to see. I know you can just barely see them because it's like white on white. They're little patches. Well, I can show you because I have to put one on. Little patch. I'm trying to curl it up there. It's sticky on one side. Think of it like, like a nicotine patch or any other kind of medical patch. And you just kind of stick it on there. Stays on for 8 hours a day. You want to keep it on, I should say, at least for the full 8 hours so that you get the full dose of the vitamins and minerals that are in it. I tend to just put it on when I take my morning medicine routine and then take it off at night. So it's on longer than 8 hours, but it's not like it's going to overdose you. It's only got that amount of vitamins in there. So basically, I mean, there have been plenty of times where I've forgotten to take it off, and in the morning I'm like, oh, that's still on. It doesn't hurt you. It's not like there's extra in there that you're going to get if you forget to take it off. And I have written on here a reminder to myself, use your Brio and use your nasal spray. Yes, I acknowledge the fact that I forget things. So, yeah, I leave myself little notes. Something I had tried recently, and I did a review of them, was this Patch MD is the brand that I get my multivitamins from. My weight loss surgeon, the nutritionist at his office had suggested it. It's a great option for people who have had weight loss surgery and have a small capacity stomach and don't want to be taking pills, vitamins all day. We eat less than people with a full-size stomach, and the amount of vitamins and supplements you have to take probably for the rest of your life, it's a lot. So it's much easier to do this once a day than it is to have to remember like maybe 3 or 4 different occasions throughout the day to take supplements. So that's how I got started on those. That same company makes other products, and I'm like not affiliated with them in any way. Let me just put that out there. I had mentioned in another video that I had been using, I had been taking melatonin for years at night to help me sleep. And, it was so-so. I couldn't 100% say that it worked, but it seemed to sometimes help, like that kind of thing. I started using these. I wanted to try this instead. It's got melatonin in it, and it's got some other things, too, like some herbal things, some vitamins, and this works much better for me than I've had the melatonin in a couple different versions. I've had just the straight melatonin pills. I've had the chewables that are melatonin, lavender, and chamomile. Those were my favorite, I have to say. I think they worked a little better than just the melatonin, as far as the stuff that you could buy in the store. These are not prescription, by the way. you can just go on to the PatchMD website and order them. They're not prescription. But I don't know if it just absorbs into my body better through a patch, or if it's the other things that they add to it that makes it work better. I'm not sure why it works better, but it just seems to work better. And then I had just recently started taking, I'll put this back in here, or I'm going to forget what I did with it. Oh, I took this out of there. I did. Okay, I'm going to have myself all kinds of confused and wondering, why am I feeling like going to sleep? That's because you put your vitamin patches into your, what do you call it? Your sleep patch. You think you're putting a sleep patch and putting a vitamin, or vice versa. Okay, caught myself before I did that. Like I mentioned earlier, I'm 52. I've been dealing with hot flashes for a good number of years now, and I had decided to give this a try because nothing else has worked. I mean, at all. I've tried, I've never gone on prescription medication for it, but I've tried any over-the-counter stuff, and I've never found anything made any difference whatsoever. And I have to say, these seem to be helping. I've gone from the blankets on, blankets off all night to much less frequently, and some nights not at all. So, can I guarantee it's going to work for everybody? No, but for me, these are a major improvement in terms of, I can show you the back so you can see what's in them, in case you're interested. It's some of the same ingredients that are in the sleep one. It also has black cohosh in it, which is probably the most common herbal remedy that you'll hear people talk about, at least when I looked into herbs that were good for helping with menopause symptoms. Black cohosh just kept coming up as the one that people recommend. And there is some of that in here along with other things. And at first I was like, do I want to invest in another product? I've never had anything work. And so I was very pleasantly surprised. First night I didn't really notice anything. Second night it was like, I think I only once kicked the blankets off. And, I use it every night since, and I've noticed that it definitely, some nights I don't kick the blankets off at all, and, or have that even before you're falling asleep, just while you're lying there in bed, reading or watching TV or whatever, before you go to sleep, your blankets on, blankets off, all of a sudden sweating, and then, you're in a room where it's already cold and you're under 6 blankets, and then you're so hot and you're kicking all the blankets off and, rolling up your sleeves and oh my God, it's hot in here, when of course it's not hot in here. It's, that's just the beauty of hot flashes. If you don't get them, be so thankful that you don't get them. But yeah, so that's what I wanted to talk about today, was just sort of where my medication regime is at in terms of tweaks that my doctors have made recently. This past week, I had a telemedicine appointment with my primary doctor, who is my pulmonologist. That he takes care of everything except my migraines, which my neurologist takes care of. And so yeah, that's with my most recent 2 visits to them. Those were the changes that were made. The addition of the extra medication, the Nurtec for the breakthrough migraines, and the addition of the second nasal spray for the sinus congestion, nasal congestion thing going on. And of course, I had at that point you can still see it. At least there's no scab there anymore. The cold sore, if you were watched last week or the week before, I guess all of last week, any video I put up, I had a horrendous cold sore, and it's finally gone. But my doctor actually had to give me something for it, because for some reason they, I got if you've ever had them, you get I got 2 cold sores in my mouth, which is bad enough. Usually you only get one. And after that, 2 days later, I got one on my lip, and he was like, no, I'm going to give you something for that, and it'll go away. So he did, and it did. If you're still listening, I appreciate that, because you have patience, and I know I get derailed in my conversation. So I appreciate your hanging in there with me to get to the end. Anyway, I hope you found some of the information I shared, whether it's, the fact that there's over-the-counter stuff to help with problems. If you're like me and you're on a ton of medications, it's probably always a good idea to ask your doctor before you add anything that might interact, or ask your pharmacist especially if you, like, I get all my prescriptions through the same pharmacy, so they can always check for interactions because they know everything that I'm on. So your pharmacist is also someone you can always ask, like, is there any interaction between this product I want to try and any of the prescription medications that I take? So, if you're on a lot of medications, I would definitely suggest that you run it by your doctor or pharmacist if you're concerned about interactions. But I just wanted to share, again, I've mentioned it before, but if you're struggling with either, getting a diagnosis, or you have your diagnosis, say, like with me with my chronic headaches, you have a diagnosis, but no one's doing anything about it. Sometimes we really need to be strong advocates for ourselves, and sometimes that's hard. Sometimes we've been raised, that, don't second guess the doctor, that's disrespectful, don't, but if you're still in pain every day, or having migraines constantly and nothing's helping, sometimes you have to kind of be that squeaky wheel in order to get someone to listen, and to realize that, okay, if you're someone like me who gets migraines more days than not, you definitely need some kind of treatment plan with your doctor. And if your regular primary doctor, isn't taking it seriously, or doesn't have the, that's not his or her, I shouldn't be sexist, isn't his or her, my neurologist and primary both happen to be male. If it isn't his or her specialty, they may not know all of the newest or best ways of dealing with your particular problem, like in my case, migraines. That's why I go to a neurologist who specializes in headaches. In fact, the only thing my neurologist does is headaches and pain management. He doesn't even take like general neurology patients. He basically treats people for headaches. That's his thing. That's his life. That's what he does. And for me, that's what I needed, was someone who really knew what they were doing, who knew like every trick in the book for my particular problem, because the most common tricks in the book apparently weren't working, the ones that my regular general practitioner doctor tried wasn't working. So if you have, don't feel like you're being ungrateful or unappreciative or rude if you're letting your doctor know that, like, this is not acceptable. Having a headache every day of my life is not acceptable. They wouldn't accept it. They would go to someone and find someone to get them feeling better. And I'm not suggesting that, you should be asking for, narcotics or pain medication. That is not what I'm saying. Although those do have their place, and I'm not saying that they don't. But a good preventative plan is definitely the better way to go. And if your doctor isn't listening, then you need to find a doctor who does. And I'll probably say that at least once or twice a year in a video, because I know how often people just give up. They just feel like, well, we've tried everything. My doctor's tried everything, and I still feel really like miserable. I almost used a bad word and I caught myself. I still feel miserable all the time. Well, that's not acceptable. If there is a specialist, which there is for pretty much everything, then you need to go to one. And this is not my first neurologist. Just like the shirt says, this ain't my first rodeo. This ain't my first neurologist. And I wasn't getting better. The one I was going to previously had me on Botox injections, trying to think. I think it was every, I want to say 3 months. I think it was every 3 months. Could have been every 2 months. I don't remember. I think it was every 3 months. I had to go take them. And that was about 30 injections all around my scalp and across my forehead and the base of my neck. Nothing, not like in my forehead, like as in nothing that would change, like not cosmetic Botox, I guess is what I'm trying to say. But all like around your scalp and the back of your neck and the areas that can be trigger points for migraines. I did that quite a few times, and it seemed to help a little at the beginning, but then it was like you get 2 weeks of relief for something that you can only get every 3 months. And the shots really hurt, and you spend the next, for me at least, the next 2 days, my head was just so tender, I couldn't even like lie down on a pillow without it hurting from all the injections. So that just, it wasn't working. And she even said to me, now she was a general neurologist. She treated headaches, yes, but she treated all kinds of neurological issues. And she said to me, I needed someone whose specialty was headaches, because my headaches were beyond, like, the Botox was kind of the end of her, comfort zone of what to do for someone whose headaches weren't getting better with what I was on at that time. I wasn't on the Aimovig. I wasn't on the memantine, which is the tablet that I take, the prescription tablet I take twice a day. Those are both things that my current neurologist put me on. And, so just because you've gone to one specialist, if they aren't helping you, go to another one, go to another one, go to another one, until someone listens and takes you seriously and gets you the help you need. We all have the right to expect to feel as good as we can. Some things are not going to get better. Some chronic illnesses, you're always going to have some level of discomfort. I have a headache a good part of a good number of days, but it's not a disabling headache. It's not, I have to lay in the dark all day headache like they used to be. It's like, okay, yeah, I have a headache, but I can still get up and get stuff done. And like, it's a mild headache as opposed to being, just your day's ruined. You're going to get nothing done. You're going to sit in the dark. You're going to possibly throw up, and you're going to cry and feel miserable and get depressed. Like, I'll take a little bit of a headache while I'm still getting things done over that other option. And it's a matter of going to the right doctor. So advocate for yourself, or if it's, your child or significant other or whomever, friend who's confided in you that they're having this problem with their, condition. If they want to let you and you're comfortable doing so, advocate for them if they want you to go with them to their doctor's appointment. And, speak up for them, because some people are shy about speaking up for themselves. And, they would step up and help someone else, but they won't stand up and advocate for themselves. So sometimes we need to step in for those people in our lives if they won't step up for themselves. But thank you. Thank you for watching. I hope you found this useful for yourself, or, like I said, for someone in your life who struggles with a chronic illness. And maybe you didn't even realize how involved it is to manage a chronic illness. But I hope, like, showing like all the medications that I take, both preventatives and to treat once there's a breakthrough of the symptoms, just kind of gives an idea of what it's like for someone who lives with a chronic illness. And even with all that, some days they're still going to just deal with not feeling well. Please like, subscribe, share the video if you know of anyone or thinks it might benefit someone else to watch it, who maybe needs their eyes open to the fact that lots of us live with invisible illnesses that we're working hard to control and that other people have no idea we're struggling with. Yeah, like, subscribe, hit the notification bell, check out my other videos, which are probably a little more entertaining in terms of my unboxings, product reviews. I do a lot of gardening videos, primarily hydroponic and container gardening, because I live in a cold area with not a lot of space. So short growing season and limited space. So I do lots of hydroponic gardening and container gardening. I talk about seeds, I talk about growing stuff. Nothing illegal, just want to be clear there. And sometimes people hear hydroponic and their mind just automatically goes illegal. Although, I guess that depends on where you're living, whether or not it would be illegal. The thing that we all know what I'm talking about, but I'm just not using the word. Anyway, yes, thank you. Thank you very much. I always appreciate it, truly. And I don't say those as empty words. I very much appreciate people taking the time to watch. Comment if you are going through a similar thing, how you deal with it. How did you find the right doctor? Did you have to, jump through hoops like I did? Took a long time to get a diagnosis, took a long time to find the right person to treat it. And like I said, I'm in no way affiliated with PatchMD, but I would check them out if you want an easy way to take your vitamins. If you take if you're someone who needs supplemental vitamins, check it out with your doctor and just, you can run it by them if they manage your vitamins and you feel better having them check it out, but you don't need a prescription to order from them. And a 30-day supply of the multivitamins is $15, so it's probably less expensive than all of the variety of like chewable or oral regular tablet vitamins that you would have had to buy anyway if you were someone like me who's had weight loss surgery and needs lots of vitamin supplementation afterwards. So again, thank you, and I hope you found it useful, informative, and have a great day. Like, subscribe, notification bell, share, comment. I think I said it 3 times. Have a great day, and thank you for watching.